Namaste everyone. Welcome to Let's Talk Health. Today is the 19th episode and I'm Dr. Rohini, consultant endocrinologist at Star Hospital's Financial District. And today we have Dr. Hariram with us.
Hi.
He's a senior consultant cardiologist at Star Hospitals in Financial District. So today's topic of discussion will be obesity and its implications in cardiovascular disease. Hi sir.
Hello, ma'am.
So, as you know, obesity has become an epidemic lately, and we are seeing more and more number of cases of obesity, and the age of diagnosis is becoming younger and younger.
Yes.
So, could you please elaborate, how to define obesity?
So you've just stated a part of the problem statement, ma'am. I think the divide is not only increasing in the age, it is also changing in rural and urban population also. Previously, we were not seeing obese patients in rural areas, but nowadays we are seeing more of obesity even in rural areas, probably because of various reasons like sedentary activity is also increasing in rural areas. So this is one thing I wanted to state. So regarding the definition and other aspects of obesity, basically obesity in a layman term for the general population is overweight, excessive weight. And this is because of excessive deposition of fat in various parts of the body. So for a layman, in terms of defining this obesity for general population, I think we can just define obesity in a easiest way as defining obesity is calculating the body mass index, where we calculate the weight and we calculate the height, and by simple formula of weight by height in meter squares, we come to a particular number, and depending on this number, we can divide the population into different types of categories. So the perfect body mass index is between 18 and 25, and 25 to 30 is overweight, and more than 30 is obesity, and more than 40 is called as morbid obesity. But for the Indians, we have again a lower numbers. So anybody with 18 to 23 is a perfect body mass index, and 23 to 25 is again overweight, and anything more than 25 body mass index is considered to be obese, because we are more prone for cardiovascular diseases, heart diseases. This is the classification that we have adapted, that even at a lower body mass index, we have to take more care.
Correct. That's exactly right. So,
there are also other ways that we can calculate, we can define as obesity. So another way is that suppose somebody has normal body mass index, but the distribution of fat is more in the abdomen, then we miss such patients. So we have another measurement called as a waist circumference, where we measure the total circumference at the level of just above the iliac bones, just below the umbilicus, and then if the waist circumference is more, then also it comes into the category of obesity. And even calculating in a simpler way, even wrist diameter also sometimes gives us an estimation of obesity. But if we want to have a perfect calculation of obesity, we have to calculate the entire amount of body fat. For that, we have different ways. We can do an MRI, we can do a CT, or we can do a DEXA scan, but these are all usually done in research purposes. For the simplest way is calculating the weight and calculating the height and giving a formula of weight by height in meter squares. That gives a body mass index, that is the BMI.
Correct. And also let me add, there is also something called waist to hip ratio that we do. Yes. And that is the waist circumference. You calculate the waist circumference and divide it by the hip circumference. And the ratio of that, it should be less than 0.9. And if it is more than that, it is also considered as obesity. And let's talk a little bit about the risk factors for obesity, sir. And here lately, as sir has mentioned, sedentary lifestyle has become a very big issue, and obviously poor diet, eating more junk foods and more sugary or having more sugary drinks is one big factor. So lifestyle pretty much. And then there are some genetic factors that also play a role in obesity. So we have to remember that everybody that is obese may not be, eating too much. We have to consider other aspects, other socioeconomic factors, and genetics into consideration too. There are also medications that can cause weight gain, like especially steroids, if they are used for other purposes like bronchial asthma or arthritis and stuff like that. They have a big side effect of weight gain associated with it. And certain diabetes medications are also associated with weight gain. And antipsychotics, antidepressants are also associated with weight gain. And there are some medical conditions like hormonal imbalances like thyroid, underactive thyroid, hypothyroidism, or Cushing's disease, which is an adrenal gland problem. These are also the causes for obesity.
Yeah.
And
so just I wanted to add on this, madam, like, so we are seeing more obese patients, especially after the COVID, because COVID has made a lot of people to work from home. And because of this, the sedentary activity has increased. Many of them are used to now work from home, and they're not even coming out even to do small amount of exercise also. So we are nowadays seeing a lot of patients overweight and obese category. So that is one thing. Second thing is, as you have said, it is not just the overeating. So if you see anybody who is obese, who is having more weight, so don't just jump to the conclusion that this person is eating more or is not doing any activity. So first of all, we have to rule out, evaluate the person, and then rule out certain medical conditions which, if treated, will result in normal weight. So this is one important thing that we should not miss.
Exactly. It is a big deal, sir, like you said, because it can actually affect the self-esteem of that person.
Yes.
There's a lot of stigma associated with this obesity in societies too.
Yes.
So we have to fight together against obesity and against the stigma associated with the obesity at the same time. And sir, tell me about the complications, or like, why do we have to even worry about this obesity? Like, what are the bad things that are associated with obesity?
So I'll be specifically talking about how obesity is responsible for increasing cardiovascular diseases, that is, diseases which are related to the heart. So number one, obesity is responsible for increasing, as itself, it is a risk factor for increasing heart diseases in the form of heart attacks. Obese people are more prone to develop heart attacks. Number one. Second thing, they are more prone to develop clots in various other places, like in the veins of the legs, in the veins of the in the arteries of the lungs also. So these conditions called as deep venous thrombosis and pulmonary thromboembolism, and they're also responsible for increasing pressures on the right side of the heart called as pulmonary hypertension. So they're also responsible for various conditions which result in heart failure also, and there is a specific heart condition, obesity-induced cardiomyopathy. And they're also responsible for electrical disturbances of the heart like atrial fibrillation and number of other electrical arrhythmias. So we call these electrical disturbances of called as arrhythmias. So they're also responsible for a condition called as obstructive sleep apnea, which again in turn results in right-sided heart failure and other conditions. So in addition to this, obesity itself increases the incidence of diabetes, incidence of high blood pressure, incidence of high abnormal cholesterol. So indirectly, it is also, these conditions are also responsible for increasing the heart-related conditions. So in summary, obesity itself increases heart attacks. Obesity indirectly increases hypertension, diabetes, and high cholesterol, and causes heart attacks.
Problems.
So it's a double-edged sword. So it in both ways it increases heart-related issues.
Correct. Let me add on to that, sir. In terms of other systemic effects of obesity, other than diabetes, hypertension, and high cholesterol that sir pointed out, it can have effects on lungs like sleep apnea and obesity hypoventilation syndrome, and indirectly causing pulmonary arterial hypertension. It can cause osteoarthritis, to the excess weight bearing of the knees and stuff. It can wear out your knees very quick. And not to forget, increased risk of cancers, like especially colorectal cancer. The risk of cancers is increased in obesity. And
even gallstones.
Gallstones and liver problems like fatty liver, or what is it called? NASH or MAFLD actually now, right? So fatty liver is increased in obesity, gallstones, and not to forget psychological issues, okay? Anxiety, depression, low self-esteem, and sleep-related issues associated with those are all complications of obesity, I should say.
Yes.
And so what do we do, sir, about the obesity? How can we tackle this?
So basically, it is a multi-pronged approach. So there is no single approach with which we can say that okay, this works for all patients. So we can broadly divide them into lifestyle modifications and medications, and then apart from medications, surgical therapies and endoscopic therapies. So first, when we come to lifestyle modifications, these are universal. This can be adapted by any patient, and the most important thing is increasing activity. So any increase in activity, the muscle is able to burn this fat and thus reduce the weight. So when we come to type of exercise, many people ask what is what exercise is probably the best exercise. So there is nothing like that. Any exercise that you are able to do it at least for 30 minutes a day and at least for 5 days a week. That is total of 150 minutes of exercise per week is sufficient, and anything more than this according to your comfort level increases the loss of weight. So it speeds up the loss of weight. The more exercise that you do comfortably, the more is the loss of weight.
The result of it.
Yeah, the more is the result of it, the faster you can achieve weight. And then the exercises may be different according to your comfort level. Some people are more comfortable with just walking, that is enough. Some people are more involved in aerobic exercises. Some people are into weight training exercises. So the best way is to do a combination of these exercises. So you walk on one day, you do aerobics on Monday, you do weight training on other days. So the combination of these is responsible for faster weight loss instead of sticking to one particular exercise. But at least the most important thing is do some activity which is helping the muscles to take all this fat and then burn it and then reduce the weight. That is the summary of it.
Correct. And to add to that, like sir said, whatever you are comfortable doing.
Yeah.
So especially people who have arthritis. Doing a biking, a stationary bike,
yes,
or swimming would be better for them, or water aerobics.
Yes.
And for kids, actually, the limit is not 150 minutes per week. For kids, it's 1 hour every day of active lifestyle. They have to play around for at least 1 hour every day. And okay, let's talk about diet, sir.
Yes.
And obviously, there are several different diets out there. Mediterranean diet, DASH diet, and whatnot. So low carb, high protein, high fat, and all that. So let's talk a little bit about diet and what do you recommend for a better diet for our patients?
So as you said, we have a low fat diet, we have a low carbohydrate diet, we have a high protein diet, we have a high fat, the keto diet. So there are different types of diets. The very most important thing is that these are extreme forms of diet. These extreme forms of diet, though they are useful in earlier stages, it is very difficult to stick to them for a long time.
Correct.
That is number one. Second thing is, many of these diets are associated with side effects. Like some of them may have liver dysfunction, some of them may have some kidney issues, some of them may have high triglyceride levels, some of them may increase cholesterol levels. So it's very important to concentrate on a balanced diet. Overall, there should be a reduction of calories because it is the calories that are responsible for deposition of the fat. The more calories body is not able to use, it will deposit them as fat. So the
Correct.
more you burn, the decreased calories you take, and the more you burn, the weight loss is faster. So the decreased caloric intent is more important, and then it should be a balanced diet. It should be easy to take, and it should be a long-term goal. It's not like I will do a rapid crash diet for 1 month and then forget about it. The weight gain is very fast. So don't stick to a particular complicated diet. Plan a balanced diet. The most important thing is you cut down the calories and then continue it for a long time. The amount of weight loss that we are expecting is around 5 to 10% in the first, say, around 6 months. That is also very useful, and then take it over from there.
Yes, sir. Like you said, the bottom line is a more sustainable diet plan is better. All diets work in short term, but for long term, pick something that would work for you in the long run. Okay. And also, I would say lots of fruits and vegetables, as much natural foods as possible, and whole grains and lean proteins and healthy fats. Okay, and just a mix of these different macronutrients would be good, and whatever works for you in the long term would be good. And how about yeah, let's talk a little bit about drugs, sir.
Medications.
Yes, medications, and we have different types of medications for weight loss. And here lately we have had more number of drugs come into market for weight loss. One old medication that we still use is something called orlistat, and that actually it prevents the absorption of fat from your intestine, from your the absorption of fat in your food. It blocks the absorption from the intestine. And here lately we have had a group of medications called GLP-1 agonists. And the very first one was Victoza, or what's called Saxenda, liraglutide. And that's a daily injection, it used to be for weight loss. But here lately we have had semaglutide that was released a few years ago for weight loss. It is a diabetes medication, but is also approved for weight loss. And here in India, we only have the oral version of the semaglutide. But in other countries, there is an injectable version of semaglutide. And after that, there has been also a dual agonist, sir. It's a GLP-1 GIP agonist, and it is called tirzepatide. So that is also once a week injection. It has not been released in India yet, but hopefully soon it will be. And these medications have shown as much as 10 to 20% of weight loss for obese patients. And let's talk, sir, can you elaborate a little bit about the interventional options for treatment of obesity?
Before going to the intervention options, ma'am, like when do we prescribe medications? So when do we prescribe medications is that when somebody is not able to perform adequate lifestyle modifications in the form, like somebody is not able to do exercise, her body mass index is more than 30, or is not able to control diabetes, or is not able to control hypertension because of this, because there is excessive weight. So we are prescribing medications mainly for those people. But nowadays, I think we are prescribing even for lower
body
BMI,
mass index, especially if we have comorbid issues, sir,
like diabetes,
hypertension, dyslipidemia.
Dyslipidemias, yes. So the same way, there are other options apart from medications, like we have interventions. These interventions can be broadly divided into endoscopic interventions and surgical interventions. So the basic summary of these interventions is that there is what is called as a satiety, like when you eat, your stomach becomes full, and there are hormones which are released from the stomach. They go to the brain and then say, okay, you stop eating now.
Correct.
So we are now, what we are doing is artificially we are reducing the volume of the stomach, and then the stomach gets filled early with small amount of food quantities, and then it sends impulses early to the brain so that you are eating less and you are satisfied with the food you have taken. So in essence, that you are reducing the calorie without having to do much. Okay, so the most important endoscopic treatment is that insertion of inflatable devices. So we have something like a balloon which is put in your stomach. So it occupies a lot of space, and the amount of food that enters into the stomach is also less now because of this foreign body that is there, and stomach get distended early. So you stop after eating a small quantity. Okay, so these inflatable devices are of multiple types, like you can just swallow a capsule which expands inside your stomach, or some balloons may have to be inserted endoscopically, and they can be kept for at least 3 to 6 months, and depending on the result, they can be continued, they can be removed, and then a new one can be put. Okay, so again, when do you use this? When your BMI is more than 35, when you are not able to get weight loss by the lifestyle modifications, diet control, and when you are not able to do regular exercise, or you have done enough amount of exercise, diet control, still your body mass index is more than 35, or you are the beginning itself your body mass index is 40, what we call as morbid obesity, or you have uncontrolled diabetes and uncontrolled hypertension, cholesterol levels are also very high. So for all these patients, we can prescribe these endoscopic medications, endoscopic treatments. So in the same way, we also have surgical treatments. In surgical treatments, essentially surgical treatments are of two types. Again, we are reducing the volume of the stomach. This time we are cutting away part of the stomach and making the stomach small. Okay, so when you eat small quantities, stomach gets distended. Again, as I said, when the stomach is distended, there are impulses which are sent to the brain, and the brain says, okay, no, now you stop eating. The other type of surgical therapies
sleeve. That's
yeah,
called the sleeve gastrectomy.
yeah, sleeve gastrectomy. So where you cut a portion of the stomach, and this is a sort of permanent treatment.
Correct.
I think. Yeah. So and then you have other treatments where the absorptive surface of the intestines are reduced. So this is called as a gastric bypass surgery, where you are not allowing the food to go through the proper channel. You are bypassing the intestines where the food is getting absorbed, and when the food is not getting absorbed, the caloric consumption is also very less. So this way we are able to reduce the amount of calories, and this is helping in weight loss. So these surgical treatments and endoscopic treatments are basically for people who are not able to do required lifestyle modifications, or not able to tolerate required lifestyle modifications. They've also used the medical treatments. Those are not working, and then only we prescribe these particular treatments, because some of them are permanent treatments, and they are also associated with side effects, because once you are reducing the surface area for absorption of food, they are prone for vitamin deficiencies, certain mineral deficiencies, and all those things, which are also to be taken care of.
Correct. And the other important thing that we have to remember is even after this metabolic or bariatric surgery, what it's called, and you achieve the weight loss, lifestyle modifications have to be continued so that you don't regain the weight back. Okay?
So this is not an alternative to lifestyle modification, like you think, okay, I'll get this treatment and then I start eating whatever I want, and I will not do any exercise, and then this will work. No, this is not going to work.
Correct.
This is in addition to whatever you are doing. As a standalone therapy, it may not help in long term.
Right. And after bariatric surgery, even if you lose the whole 20-30% of body weight, you can regain everything if you don't watch your lifestyle. So that is the bottom line.
Yeah. So in summary, so we have to know that obesity is a very important problem, and the incidence of obesity is increasing nowadays because of increasing sedentary lifestyle, because of various reasons. Say it is work from home or decreased activity, especially in schools nowadays. We are seeing that the activity is decreased. Students are now more into studies, and outdoor activities, indoor activities are all very less. So the obesity is increasing, and it is responsible for number of diseases, increasing heart attacks and increasing cancers, increasing clots in the blood vessels. So it is very important to recognize this particular problem, not leave it saying that that person is like that right from the beginning. Okay, and the simplest and easiest methods are increasing activity, exercise, cutting down on food intake, calorie consumption is to be decreased, and if this fails, then we have certain medications. If this fails, then we have surgical treatment and endoscopic treatments. So whenever you have any of these problems, obesity or obesity related problems, please visit your physician, visit your cardiologist. They will advise you, and they have a team approach. We have a dietitian, we have a bariatric surgeon, we have an endocrinologist, we have a cardiologist, physician. All of us sit together and give you a plan of how to go about these things and help you out in achieving a proper body weight and a healthy lifestyle. Thank you.
Yeah. Seek help is again a very important,
most important.
Seek help, and we're all here to help you. And thank you so much, sir.
Thank you,
wonderful, enlightening discussion today, and thank you for joining us.
Thank you.